Hi, I'm Taryn. I'm the intimate health nurse here at Sparkle Lifestyle MediSpa. If you're somebody who has issues with being able to hold your bladder, sneezing is a little dicey, trampolines are an absolute no-no, and coughing in public is a terrifying experience. While it's a super common issue, it is not something that you have to live with. Today we're going to talk a little bit about urinary incontinence and something that we can do to help with it. Urinary incontinence is when we are unable to control some of the muscles that keep our urine inside our bladder, leading to sometimes small leaks or even full-blown losses of control. Incontinence can look different for everybody. It's not just the person who has to wear a pad. It could be always needing to know where the bathroom is because you have to go super frequently. It can be not being able to hold your bladder once you get that urge to pee itself. It could be having to cross your legs every time you laugh really hard or sneeze or cough. It could even be impacting your intimate life where you don't feel comfortable with your partner because you feel like leaking is going to interrupt that time together. Sometimes even mild to moderate exercise like lifting heavy things or working out at the gym can cause some concern because there's always that fear in the back of your mind that you might leak. So the leaking of urine can be caused by a couple different factors. Oftentimes as we age, the strength of our pelvic floor muscles kind of diminishes, making it harder for us to be able to hold the bladder, our uterus, everything like that in our pelvis where it should be. Those are also the same muscles that tell the opening of our bladder to open and shut. So as those get weaker, our ability to control our urine also diminishes. A weak pelvic floor can also be caused postpartum or even just by pregnancy itself. So you don't have to have had a vaginal delivery to experience pelvic floor dysfunction. Even just the weight of the baby, the stretching of the uterus can sometimes damage those pelvic floor muscles. It's really nice to have a treatment that fits a variety of different people with a variety of different issues and help them become more comfortable and in control of their bodies. So this is our Emsella Chair. That is our go-to treatment for incontinence issues. It's a really great treatment because there's no downtime. It's only 28 minutes from start to finish. There's no reason for you to be unclothed. You can come in some comfy yoga pants, maybe a pair of sweatpants and a hoodie, and you just sit. That's the hardest part. So the way that it works, it's a little bit like a TENS machine that you would use for sore muscles at home. It targets your pelvic floor specifically and is the equivalent of doing roughly 11,000 Kegels in the span of those 28 minutes. So it really works to strengthen those tissues. So during the treatment itself, there's no pain and not really any discomfort. You will feel your pelvic floor and the muscles down there tightening and relaxing as the machine does its job. It's almost like waves that happen while the treatment is occurring. Afterwards, there might be a little bit of soreness, specifically because those muscles are weak and they're being worked out finally. So you can expect a little bit for the first 2 to maybe 3 days after treatment, and then that should relax. Sometimes for some people, incontinence can get a little bit worse for the 1 or 2 days immediately following the treatment. That's because those muscles have gotten tired from the treatment itself. So also something that you should prepare for. Each of the sessions is tailored to the person. Especially for your first session, we sit in with you for the duration just to make sure that you're tolerating it, that the strength of the treatment itself is perfect for you. Some people need a little bit more power, some people need just a little bit of power before they're able to feel their muscles contracting. So that's something that we figure out together when it's your first time. So obviously incontinence is the big reason that people are using this chair. People who have stress incontinence with sneezing, jumping, coughing, laughing really hard. If you're one of those people who has to cross their legs or make sure that they're guarding themselves before you do any of those, this is a great treatment for you. It's great for postpartum women who have had stretching of those pelvic floor muscles during childbirth and are looking to get that strength back. Some people find it helps a little bit with sensation down there as well. As the muscles tighten up, the sensitivity increases and you're able to reach satisfaction a little bit easier. This treatment is not for people who are currently experiencing their menstrual cycle during the time frame of the treatment. We want to either do it before or after your menstrual cycle occurs. It's not for people who are pregnant. It's not for people who have piercing close to the treatment area or metal implants in their hips or something like that. IUDs are not a contraindication, specifically the Marina or Kindly IUD. It's the copper IUD that would make this service unavailable for you. People who are experiencing severe uterine or bladder prolapse are not suitable for this treatment either. Also, people with a history of heart rate irregularities, this also might not be the best treatment for you. Typically, when we're talking about a full treatment using our Emsella for urinary incontinence, we're looking at about 6 treatments initially that are spaced pretty close together. So you're going to be looking to come in and sit on your chair every 3 to 7 days for 6 treatments. After those 6 treatments are up, we always recommend doing maintenance treatment once or twice a year just to make sure that those muscles retain their strength. If this treatment is something that interests you, please reach out to us here at Sparkle Lifestyle MediSpa and ask for a consultation with me. Again, my name's Taryn. I'm the intimate health nurse here.